Welcome everyone to our Find-A-Code 2027 ICD-10-CM update. I think we have a lot of new people. We got double the registrants, so this is a popular topic. How you doing, Alicia?
Doing great, and you know that this is my thing. This is my jive. So I got the mojo going. Yeah, I love this. I love this time of year when we get the new codes.
And were they early this year? They felt a little early.
No.
They normally? No? Okay. I guess we're just
right on time.
Ready early.
Yeah.
Oh, that's a good thing. So let's see, where are people dialing in from?
I see some new places.
We got
Jonas, Los Angeles. Shaquana, Las Vegas.
Texas, Missouri.
Sharon's in Pennsylvania. Natalie. Houston. I've gotten to go to Houston and speak for them several times. So shout out to Natalie. Oh,
so how's everyone beating the heat? Is everyone dealing with the hot heat?
Well, Jessica is joining us from Phoenix, Arizona, and I'm sure that even though we're complaining about the heat here, it's got to be a whole lot hotter in Phoenix, Arizona than it is here.
And I see a name, Anthony outside of Philly. Do I know you personally?
Anthony outside of Philly.
Someone I knew from my New Jersey days. If so,
Mississippi.
Welcome. Yeah. All right. So I think the best way for us to do it, I'm going to let you drive the slides. Let me just do a couple introductory things before we get started. Let some people get in here. Most people, well, I don't want to say most, but a lot of people join this because they're looking for that free CEU. And this is a topic all medical coders need to get updated on every year. We'll be doing the CPT one probably in a couple of months. I think the new CPT codes come out where we can start creating slides about it more toward October. So be looking for that. So what you're going to do, because these are free CEUs sponsored by Find-A-Code. Thank you, Find-A-Code. Really appreciate that, especially with AAPC. Keep increasing those prices for CEUs. It used to be like under 200. Now it's 412 for one CEU. So very grateful to Find-A-Code so that we could bring this to everyone for free. Now, a lot of people that are already coming to these webinars have joined our free forum or our academy. There is a link you can go to, cco.us/CCO-free forum. I'll put that in the chat because it does have some dashes in there. And then the next step, once you sign up there, that will give you your invitation to the academy. It's free. You don't have to pay for anything, but that's where you kind of get, locked in to be able to go take the CEU quiz and get the certificate from the AAPC. And then we also wanted to let you know that Find-A-Code has done this for the past couple of years. So they did this last year. So we have 2 free CEUs already that haven't expired. They're going to expire soon. So you could actually get not only tonight's CEU, but those 2 free ones, and then get the one coming up in October that's going to be free and sponsored by Find-A-Code. So that could actually be 4 if you haven't claimed the other 2 already. That's for last year's update, the 2025 updates. So yeah, so it's up to you if you want to, if you need all of those, it'd be great. Let's see here. I think what I'll do is after your presentation, then we'll wrap up and we'll go over some of the announcement slides. So I'm going to turn mine off and let you turn yours on. Oops, remove, add. That's yours, yes?
Yes, that's me.
And if anyone has questions, just post them in the chat, and then Alicia can answer them at the end. But I'm going to star the ones so that I remember to pull them up toward the end.
Okay.
Thanks. Enjoy.
Now, I don't know if you guys all know how much I love ICD, but if you've been to any of our webinars at all, even one, you probably know that that's the code set that I like the most. So welcome everybody. We are so excited that you're here. This is a fun time for me every year. And this new CCO Academy that we've started is brilliant to work with the new code set. So we'll be talking about that a little bit in the future or at the end of the webinar. But right now, we're going to look at the 2027 ICD-CM updates. And I'm really glad you're all here tonight. So over the next, say, 45 minutes that we're going to be working through here, we're going to walk through everything that's meaningful as far as changes that you need to absorb for the October 1st, 2026 change or updates. And that means right now, make sure that you mark your calendars, especially if you're new, that October 1st is when these codes go live. Now, the webinar is, really built for a mixed group of people, whether you are a student and you're still working to get your CPCA, or if you are a new CPCA and you're on a team, or you're an experienced coder or an auditor, you're going to all find something that's going to be pertinent, that's going to help you move forward with this code set update. Now, it'd be really helpful to us. We'd enjoy it if you would go ahead and type in the chat, are you a student? Are you a new coder? Are you an experienced coder or auditor? Let us know what your background is, and that allows us to get a feel for the room. And also, any questions that you have along the way, feel free to put them in so that we can work on things that are more pertinent to your needs. Already showed you this slide, but the free forum link, we'll get that out there to you to show you how to register. I know I just popped up that somebody had already registered and gotten their information for the free CEUs. So every year when CMS and the CDC, National Center for Health and Statistics, release the new ICD code set, the headline is always the same, here are the new codes, but they never really tell you the rest of the story or the behind the scenes. And a lot of times when we see presentations on the new code set, some of those presentations can be rather dull. It's nice that often they'll associate a CEU with them, but it's like, oh, here's the new code and here's the description. Oh, here's the new code and here's the description. We try not to do that. And if you go back to our last few updates that we've done, we try to make it more meaningful for you and kind of give you the real story on why the new codes were created in the first place. So for the fiscal year of 27, the update really tells a story, and the documentation, we have to realize that there's always more detail as we get new diagnoses and procedures to take care of those diagnoses. It's really meaningful knowledge, and it's advancing so rapidly, and payers, regulators, and you've got quality researchers, they're all demanding greater specificity than ever before. And so there's always a need, there's always a lack for describing a better diagnosis. Broad and often unspecified codes, they're really losing ground, right? There's granular, condition specific. We've got laterality bearing codes that are taking they're taking space, where if we don't feel the need for those gaps, then we're lacking. We're doing a disservice for our patients and also our statistics. So the lens that we're going to look through for the next 40 minutes, we're going to look at specificity, we're going to look at documentation, and we're going to look at reimbursement accuracy as well. Now, here's what's coming. We're going to look at the fiscal year for 27 in the ICD-10 tabular. Now, the official one, the CDC and the CMS published this past spring, adds approximately 190 new diagnosis codes with 4 revised descriptors and like 30 invalidated codes. Now, a quick reconciliation note though here, because when CMS released the IPPS, the proposed rule on April 14th, 2026, the proposed numbers were you get 184 new codes, there's 4 revised codes, and 30 invalidated codes. They published for fiscal year 27, the tabular landed at roughly like 190 new, a small upward adjustment, but the order of and magnitude is the same. So if you see either a number in a tip sheet, something like that, and it's a different number, don't worry about it. It's defensible. For production coding, trust the CMS posted tabular file, not any third party summaries. Okay. So always go to source. And these codes go live for discharge and patient encounters occurring on or after October 1st of 2026. And they remain effective for the full year till September 30th, 2027. Now, Find-A-Code is fabulous. I know you guys know that we appreciate them. They kind of had us at their theme colors are almost exactly like ours, so that's kind of fun. But we absolutely love the way that they demonstrate and show the new codes. What you're going to go to is Find-A-Code, and then you're going to be able to go to diagnoses in the drop down, and then down here you'll be able to see the previous year, sometimes more than that, but for this example we've taken a picture of the 2025 codes and the 2026 codes, showing that they're new. Now the 2027 codes will populate that area. And look what they do. This is why I really appreciate this. New codes for 2026. Okay, that's all of the codes, and they end up being alphanumeric. Then the changed codes for 26, the deleted codes, and the reactivated, which there's usually no reactivated, just heads up there. But know that the deleted codes are usually codes that are being expanded. They don't, get rid of a code. They give more specificity to codes so that it becomes like a parent code and then it's expanded out. It is so easy to follow this. I've never looked at an encoder that's as easy to follow as Find-A-Code, and I really appreciate that about them. Now, this is what it looks like on the screen itself, the new codes for 2027. If you see here, this will tell you when this particular code was added. Now, we just picked one, but not only do you see the new date, you can actually, in Find-A-Code, let's say you're doing research or you're needing to check it to see if something was valid in a previous year, you can go into Find-A-Code and change it to a previous year and go way back. That it's also brilliant and so handy. You got to remember to go revert back to the current year, but it's so much easier than trying to go find an old manual. If you guys have been doing this as long as I have, you know what it's like when somebody says, well, yeah, but what did they do in 22? What did the manual actually state in 22? And some people have all of those manuals lined up. I do not, because I can just go to Find-A-Code and bring that up. So again, here's what you look at when you see the actual code. Very user-friendly, but you will see the date that the code started. You will see when a code was deleted if you type in a code that's no longer valid and say it was expanded, and it will actually tell you, hey, go and look at, and it'll show you the other code. So again, very user-friendly. Find-A-Code also has a CLD every new code. So for example, one for a new code, common language description would be right here. And I've used these in education quite a bit, but another reason I think this is brilliant and I'm very pleased with it is that it gives you the behind the scenes of the diagnosis. It breaks it down. It gives you the signs and the symptoms. The common treatments often are in there as well. So you're not, say you come across a diagnosis that you're not familiar with, you don't have to go digging out on another source, right? You're right there and you can read that description and get the background that you need. Even sometimes it'll tell you medications that are used for specific diagnoses. So again, brilliant. And if it doesn't give you the full description, it gives you enough information that makes you knowledgeable enough to articulate if somebody asks you a question about that diagnosis or where to launch your research. But most of the time, everything you need is right there. I've used it, again, a lot of times. Now, here's another example, is a very common thing. Let's see, hearing loss. So with this particular one, they're telling you what Usher's syndrome is, and you probably never heard of that. So if you don't have anybody in your family that has hearing difficulties or hard of hearing, or I suspect you've never heard that. But in documentation, what you see often is they'll say type 1, 2, or 3. Well, if you don't know what that is to be able to get assign a say it doesn't say that, but it gives the description or whatever, then now all you have to do is look. Type 1, profound hearing loss. Type 2, moderate. Type 3, progressive, which seems to be the opposite, right? Because usually you would think type 1 is the less hearing loss, 2 and 3, but again, it also gives you information like report other when the documentation specifies a type which is not otherwise described by a different code. Report unspecified when the documentation does not specify the type. This is common language and common knowledge throughout the whole code set. And so they're still giving you not only detailed information, but information that is going to be applicable with other codes. Well, now that you've had a chance to see how brilliant Find-A-Code is, how easy to use, and feel free to type in the chat if you want more information about Find-A-Code. We're going to wrap up and give you some links later at the end. But I think you understand how much we appreciate using them. I would say that we've been working with them for over a decade, or maybe longer, and they only just get better. Now let's go ahead and jump into the meat of the changes of the code. So compared to the fiscal year 26 update, which gave us like 614 new codes, and they reshaped like chapter 19 around the flank body site. That got a lot of love that year. The fiscal year for 27, it actually is a much shorter release, one of the shorter ones that we've had in some time, but it's got a lot sharper focus. So the changes concentrate in 6 clinical areas. So get your little spidey senses, coding spidey senses up if these are areas that you work in. Cardiology, that's a big one, particularly inherent and genetic conditions. We got information, new codes in hepatology, also for filling a long-standing gap in liver disease staging, musculoskeletal and podiatry. They had laterality expansions. ENT, which usually doesn't get very much love, they added sinusitis with dental etiologies, which was much needed. Infectious disease, most notably, we got a new history code for resolved C. diff, and nutrition, more defined for low BMI reporting with adults. But most of the new codes don't create new categories. They just expand what's existing in the categories already, just with more details and subcategories, meaning that the code you used last year may now have a more specific sibling that you should be using instead. Because again, when a code has expanded codes. We kind of like to call those parent codes and then little siblings. Before you get in too comfortable, we're going to look at some clinical specifics. Now, a quick note on who this webinar is built for. Again, if you're a student coder working towards your CPCA, you're going to get a big picture context of the clinical grounding you need for exam prep. The new code families we're covering will absolutely show up in the AAPC and the AHEMA exams within roughly like 90 days of the official guideline publishing. Now, if you're a new coder and on, say, an AS or AR team, this is your 90-day plan readiness heads up. So we're going to walk you through what to do with the top 10 new code families and help you with a checklist for getting your team ready. Now, if you're an experienced coder or maybe you're an auditor, we're going to spend some real time on the nuances as well, like the DRG ripple, risk adjustment changes, and how the new granularity changes your query strategy. So stay with us till the end, but pay particular attention to slide 16 if again you are a you're an auditor per se. Now that's where we're going to have that DRG conversation. No matter where you sit, by the end of this hour though, you're going to know exactly which pieces apply for the role that you're in. We're going to start with cardiology, one of my favorite areas, because this is where we had some significant changes for the fiscal year 27 in the update, and that is going to affect clinical work. So for years, providers have had to map inherent cardiac conditions onto like broad parent codes, right? That didn't capture what was really going on. But this next set of updates is going to fix a lot. You'll now be able to decide between reporting options for Brugada syndrome, which is an inherent sodium channel disorder that predisposes patients to sudden cardiac death. We also have catecholamic polymorphic ventricular tachycardia, which we never say, we only say CPVT, and that's why it's such a mouthful, which is actually also another inherent arrhythmia syndrome. Typically, it's triggered by exercise or emotional stress. We have ventricular bigamy, yes, which is a specific rhythm pattern that was previously absorbed in, say, a broader ventricular arrhythmia code, and now it's expanded in with genetic and inherent cardiomyopathies, including better granularity for hypertrophic, dilated, and arrhythmiomagenic forms. It is huge, the love that cardiology got. And I think it's probably one of the biggest areas. So these conditions actually aren't new. And when we look at the new codes, that's the whole thing. They're not new codes. What happens is there wasn't a code for it in the past. So instead of having these other codes that we had to use, or sometimes you had to use unspecified, we actually get a code that describes it. So the ability to capture them with precision, that's actually what's new. And that's a documentation query opportunity sitting in every cardiology chart you touch. So if cardiology is your area or you're an auditor, heads up. So what does this mean for, say, an AS or an AR team? If your provider documents inherited cardiomyopathy without specifying the type, then you need to query, because if the genetic test results is in the chart and the diagnosis line just says cardiomyopathy unspecified, then you query, because the specificity is there. Your job is to bring it to the code to make that connection. Remember, we aren't doing this just to get paid. we are thinking about the statistics. So this is the documentation improvement story backed into the 27 release. Every cardiomyopathy chart you touch is an opportunity to surface the clinical detail that already is in the chart, but not yet on the claim. Now, here are 4 query categories you'll want to have in your toolkit for new cardiology codes. We have genetic confirmation status. Was Brugada or CPVT confirmed by genetic testing, or is this a clinical diagnosis based on an ECG finding? That changes the code selection. It triggers a circumstance. For ventricular arrhythmias, was the event exercise induced, stress induced, or spontaneous? This is huge. This makes a big difference in understanding the disease process as well as the treatments that are going to follow, protocols that go into place. So some of the new codes are circumstance specific. So family history detail, first degree relative with sudden cardiac death or known other types of canalopathies, supports the inherited cardiomyopathy codes and linked complications. You've got syncope, ICD placements, antiarrhythmic therapy. These justify the Z codes and history codes that bundle into the same encounter. You will want to build out your auto text or dot phrases for your providers around these 4 questions, and you'll cut that query volume in half by just a matter of weeks. Again, it's our responsibility to let our providers and clinicians know that these new codes are available. Therefore, we want to make sure the documentation meets so that we can capture and translate properly. Okay, now we're going to move to hepatology. And one of the most important quiet wins in the whole release, because they've been talking about this for years and they finally got their code. So kudos to them. Moderate hepatic fibrosis. So for years, coders had 2 practical buckets that you could use: early stage liver fibrosis and full cirrhosis, but there wasn't anything in between. So for 27, they've set aside codes for moderate hepatic fibrosis, which is exactly where a huge swath of those patients with non-alcoholic fatty liver disease, chronic hepatitis C, and metabolic associated steatohepatitis actually live in, right there in the middle. So if your hepatology providers document fibrosis staging, and I suspect they do list the F2, F3, the FIB4 scores, transient elastographic results. There's never been a code for that to match in the past. So that precision really matters for severity, stratification, risk adjustment, and quality measurements. Okay, let's do a real coding scenario because we love to do that. Let's look at a provider note that we've got here. We have a 50-year-old with NASH, and that's non-alcoholic type of hepatitis. FibroScan shows stage F2 to F3. The AST is 68. The ALT is 74. There's no varices on imaging. Now, in 26, this patient was coding. It was a coding nightmare. It caused a lot of headaches because K76.9, other unspecified liver disease, was too vague. And then K7460, unspecified cirrhosis, well, that's way too far because the patient isn't really at that cirrhosis level yet. So this patient isn't actually at that stage of K7.60. So what do coders do? They ended up defaulting to K76.0 or sometimes K75.81 when in actuality, neither one of them captures the clinical picture or supports the HCC surveillance the provider is ordering. So in the new year for 27, the what we now have is new moderate hepatic fibrosis codes, which fills that exact gap that we had. It accurately represents the F2 to F3 bridging stage. It supports surveillance billing and feeds the risk adjustment model correctly. This is the kind of change that quality improves both, or quietly improves both quality scores and reimbursement without a single extra dollar or effort from the provider. So it was much needed. And I know there's a lot of people out there that that do that area that are thrilled about this new code. Now, one of the areas that we very seldom see much happening is ENT. This is one of those also quiet wins for those ENT coders. So otogenic sinusitis. When a maxillary sinusitis affection traces back to the dental root, say an implant or an extraction, and clinically, that's surprisingly common, there's now a specific code for that. They've never been able to capture that. So previously, coders had to choose between a generic chronic sinusitis code and an unrelated dental code with no way to convey the etiology. But now for this new 27 update, that's going to close that gap again. The code now captures the dental cause directly. So for ENT coders, when you see documentation that connects a sinus infection to a dental procedure or an implant, use the new specific code rather than that generic chronic sinusitis code. The specificity carries forward into payers' audits and outcome trackings. Brilliant. So glad that we have this new code to be able to do that. We also have plantar fasciitis and osteomyelitis updated with laterality, two of the most coded musculoskeletal conditions in podiatry and orthopedics finally get laterality. So if your provider documents, right plantar fasciitis or left calcaneal osteomyelitis, that distinction will now show up in the code itself. This is exactly the kind of detail that matters for repeat encounter tracking, surgical planning, and quality reimbursement. Now, for podiatry and orthopedic teams, laterality has been a documentation expectation for years across other body sites. Now, your foot and ankle codes finally are catching up. So make sure your encounter templates and dot phrases prompt for left or right, because they've never had to do that before, right? So again, you want to make sure that that's ready before October 1st. Another area that is really practical for those AS and AR teams, it will use almost every day. First, history of resolved C. diff infection. Until this update, when a patient had a documented prior C. diff infection that had cleared, but they were still being monitored for reoccurrence or being treated cautiously around antibiotics, there was no clean way to communicate that history. And that is a type of infection that you have to monitor closely. It often is not cleared up when you think that it is. So for fiscal year 27, we have a dedicated history code. This is going to matter because patients with prior C. diff are at materially elevated risk for reoccurrence, hospitalization, and complications. So we're going to be able to make those golden thread connections, unlike we have been able to do before. The history code strengthens both the clinical communication and the risk adjustment quality scoring. Brilliant. I'm not sure how many risk adjustment people we have here, but if we do have some, put it in the chat. I'd like to get to know that you're watching. All right, moving on. Second, This is another area that we've really needed. They refined low BMI reporting in adults. So BMI codes have existed for years. We know there's specific rules about the BMI codes and documentation and so on and so forth. But what often got overlooked, and I found this in risk adjustment and still happens today in everyday coding, is that when a patient has a low BMI, it's not, it's documented, but nobody tends to pay attention to it when they're capturing the codes for that. But the granularity at the low end was thin. So for our fiscal year 27, the update adds more precise codes for adults with lower BMI measurements, which matters because a low BMI is associated with elevated risk for skin breakdown, nutritional deficiencies, impaired wound healing, and when you have immune disorders or complications and concerns. More precise reporting improves patient risk stratification and quality measurements. Now, these two codes alone, C. diff history and refined low BMI, are going to come up in your encounter notes more often than the cardiology codes, I would estimate. But don't underestimate any of these new codes that are happening. Another thing is that there is a code for malnutrition, and a lot of times when people get a low BMI, they you may get that malnutrition, but you don't get that low BMI code. So now we're able to paint a full picture for the patients. Moving on, the part that nobody enjoys, but everybody has to manage because it's especially if you're in a leadership role. 30 codes are invalidated as soon as October 1st, 2026. It's just around the corner. It happens much faster than you think. And there's a lot that we got to do to get ready for that. Most of these codes that have been replaced by more specific subcategory codes or codes that created a conflict with new entries, we discussed. So either way, any encounter dated October 1st, 2026 or later that gets posted with one of these 30 invalidated codes is a clean claim denial just waiting to happen. Now, your action. What we've got for you is a 3-step playbook. Pull every active code on every super bill, every encounter template, every order set. Match against the fiscal year 2027 addendum file. Replace the deleted codes with the fiscal year 2027 successors before October 1st. Don't wait for denials to find them for you. Run your Q3 2026 Super Bill scrub now. Okay, here's a wrinkle. I'll get a drink while we're doing that. As of the date that we're recording this right now, the fiscal year 2027 ICD-10-CM official guidelines for coding and reporting PDF has not yet been released by the CDC's National Center for Health Statistics. The CMS ICD-10 page literally says not yet available, but the tabular's out. Okay. So the addendum's out, the conversion table's out, the POA exempt list is out, the guidelines PDF, which tells you how to apply all of that, is still pending. The truth lives in 3 places. Okay. So in this order: 1, the CMS tabular and addendum, the codes themselves, out now. They're ready to go. 2, the CDC, the NCHS official guidelines PDF, when published, monitor the CMS ICD-10 page weekly through July and August. Okay. And then 3, recognize specialty publications. You've got the AAPC, AHEMA, Practical Neurology for how to apply the codes to real world charts. And tip sheets are great, but they're not authoritative. You need to go to the source, and that's what we've given you here. So here's your 90-day readiness plan that we worked up for you. You've got 5 steps. Step 1, update your encoder and EHR. Confirm with your vendor that the fiscal year 2027 patch is scheduled to deploy before October 1st. If you work with Find-A-Code, they've got it in the bag. Super easy. Step 2, scrub super bills and dot phrases. Pull every active code from every template. Match against the fiscal year 2027 addendum. Replace the deleted codes and add in the new high impact ones that we just discussed. Step 3, train your coders and auditors. You need to be doing that now. Build, say, a 1-hour internal session with the top 10 new code families and use real charts from your own organization. That would be ideal. Step 4, draft documentation improvement queries. So for cardiology, hepatology, ENT specifically, draft 3, say, to 5 query templates and that prompt providers to specify the conditions that we just covered. You know what's coming down the road. And step 5, run a pilot week of dual coding, say in late September, and dual code a sample of encounters using both the 26 and the 27 code sets, and then compare, where they diverge. You found a training opportunity or a documentation gap. And if you want, you can take a screenshot of this slide to make your plan, or you can just check back with the Academy. I'll pause it there for a second if you want to. Okay, counting 3, 2, 1, moving on. Okay, one more layer, guys, that the experienced coders and auditors here, this is where you play the biggest role. So with the 27 ICD changes, they don't live in isolation. They feed the MSDRG's grouper version 44, which CMS released at a test version inside the 2027 IPPS proposed rule. New cardiomyopathy codes can shift complication and comorbidity status. New hepatic fibrosis codes can reclassify severity, better laterality on osteomyelitis, and that can affect surgical DRG assignments. That's all going to ripple downstream to MSDRG payments. Case mix index can move materially to risk adjust quality scores. You've got readmission rates, mortality indices, and HCC values, and to severity benchmarks. Now, your hospital's expected mortality and complication rates may need, say, a re-baselining. And auditors, if you don't rerun your benchmarks against the 27 code set, you'll spend the Q4 chasing anomalies that aren't anomalies at all. They're just the new normal. All right, before we wrap up, let's hit the 5 questions we hear most often about the code set transition. Like this one. The first one is there a grace period after October 1st, 2026? In 2027 when that new code set starts? No, there's no grace period in the annual update. The deleted codes will reject at the clearinghouse and on encountered dates of October 1st or later. Bam. That's when it's going to happen. Okay. So again, you have to have your plan in place now. The second biggest question we get, where do I find the exact code numbers? CMS, ICD, page 2027 code description in tabular order, and the 2027 addendum. They're both zip files. That's where you're going to find them. 3, what if my EHR vendor is late? Document the gap, log it with compliance, and use a manual lookup against the CMS tabular for affected encounters. Again, if you use Find-A-Code, you don't have to worry about that. Hopefully, right? 4, are the fiscal year 2027 official guidelines out yet? Not as of June 2026. Monitor the CMS ICD-10 page weekly. Use the FY26 guidelines with FY27 27 codes in the interim. And 5, will this affect my CPC or CCS exam? You've got the AAPC and AHEMA typically update exam content roughly about 90 days after the official guidelines publish. So again, these tests are all digital now. So in the past, the tests were created before, now they're not. So they tell you best practice, that 90-day window is when you're going to see the new codes drop in the manuals. All right, guys, let's land the plane here. 3 numbers to remember. 190 new diagnosis codes. October 1st, 2026, your go live date. 6 chapters doing most of the work. Cardiology, hepatology, MSK, podiatry, ENT, infectious disease, and nutrition. You've got 3 action plans to take this week. 1, download the REQ 1568 reference sheet from the link in the follow-up email. 2, schedule your Super Bill scrub for late August, or you can go as far as early September. 3, draft your first 3 documentation queries for cardiology, hepatology, and ENT. And we've got a download reference there for you. I think Lori may pop that in. And then
it's going to be in the club. Yeah.
Be in the club. Okay. And if you want a full coding context, include the specific code numbers as they appear in the 27 tabular, implementation timeline week by week, and the audit checklist. That's all in the companion blog at our site, the CCO ICD-10-2027, and in the downloadable reference sheet that's going to be set up there for you. Drop your single biggest open question for the 27 update in the chat right now. We'll cover the top 3, say live if we have time. And thanks so much, guys. So stay sharp, stay curious, and we'll keep tracking your progress. We're there to help you along the way. We've been doing this for a long time.
Thank you, Alicia. Good job. Good job. So what'd you guys think of the slides from compared to last year, where AI has really given us some really nice infographic slides? And for me, very visual learner, it just helps me so much. And I have been teaching coders since, I don't want to say for how long, but 1999. And, I find a lot of coders are visual learners. They really, that helps them a lot. So, so we're getting all these thank yous coming in. Great presentation. Thank you. So no one had any questions. So I think it was pretty straightforward. What's your favorite change?
Dazzled them. We dazzled them. That's what it is. There's so much really, really good content. What were you going to ask me? What's my favorite?
Like of the changes, what do you feel is going to impact you the most on your day job?
Cardiomyopathy. Absolutely, the cardiomyopathy. What a huge game changer that one's going to be. And I know that and hepatology, they've been asking for that for years. One of the unique things that when you've been in the industry for a long time, if you get to go to conferences, or you really reach out to peers and stuff, that you get to meet people that actually request new codes, or and that process is really, really fascinating. And I've got to meet a few people that have done that, and they talk about the pain points not having a more specific code is for them, not only in revenue, but we know statistically what it does. So again, it's even more fascinating when you get to see that behind the scenes. It's not just them getting together in a room and saying, oh, I think we need to expand these codes. No, people actually submit letters and proposals and documentation as to why this code is necessary. And that's how they pick and choose who's going to get, what areas are going to get love. And so again, they don't just say, okay, we're only going to do 100 codes this year, or we're only going to do, 600 codes. It's fascinating. And remember, when we say 600, you have to remember, because it's such an expansive code set, a lot of that is laterality and body parts that are, something that can be done for every body part. So it isn't really that many when you boil it down to the base parent code. that's being
This
expanded.
is my favorite comment. Dazzling
No,
divas.
dazzling divas.
Jessica had a good question. Is the CPC test going to have the new codes in November? No. They will typically January 1st is when they will use the 2027 codes for ICD and CPT. So, but always check the source, go directly to AAPC. I think they still have an email, exams@aapc.com. You could try that, and that way you get it in writing. But I'm 99.9% sure that the new codes you won't be tested on until January. And keep in mind, they don't rush to go put new codes in their test. We create practice exams. We have over, I think we're up to 60,000 questions in our database. And what we do when we vet our questions each year is we go and we look at the deleted list and we go scan our questions. Are there any deleted codes? And we flag them. And then we go in or we have the interns go in and reword the question or change the answer so that it meets the current guidelines, like the cardio ones. Now there's more specificity. So we find a code that's deleted. We don't really throw out the question. We just have to give it better answer choices so they can get that specificity. And what we spend a lot of time and resources on are the rationales for our practice exam questions. So you really learn a lot. It takes a lot to update them every year. It's getting a little bit easier with AI, but you still need people like Alicia and I to, vet the AI, but it does a lot of the grunt work, if you will, to get it ready, do the skimming, looking for deleted codes and that sort of thing. So I did want to take a minute, if we don't have any other questions, just lots of positive thank yous. I wanted to show, because Find-A-Code is sponsoring us, just some new things we didn't have on the slides about their new AI, which is actually really, really good. And I was just talking to the gentleman from Find-A-Code yesterday evening, and we're all very excited about AI and what it can do. And it's not that, and I've done other presentations before about AI and coding. It's not going to take our jobs. It's going to change our jobs. It's a new tool, just like when we got encoders, like Find-A-Code. Everyone was worried that it was going to take their jobs. When computer-assisted coding came on the scene, that's what I do during the day, is develop, codes, and they suggest codes, but there's human coders looking at them and say, oh yeah, it got it right, or it didn't. And then we try and make it better and better. So it's a tool that allows coders to do more in less time. And then they will be elevated to maybe do the harder cases that an AI can't handle. So at any rate, let me show you that.
And while you're doing that, this is a really good question that came in. Do the guidelines change with the new updates in 2026? The answer is yes, guidelines do change, but they don't change in the way that you think. A lot of times there's little nuances that change, but not major guideline rules that change. But the easiest thing to do is just to open up the new guidelines, and anything that is changed is in bold. And you can just you grab them at the blink of an eye. So that's the easiest way to look at them. We would let you know if there was a major change in a guideline rule for the year, like what they did in 2016, and stuff like that. But right now, there's not really anything.
I want to let you know too, because it goes along with the updates. The official ICD guidelines are on a PDF. It's available for free out on the internet. We take that PDF and we annotate it. This started years ago when Chandra was with us teaching, and because we were talking about our BAT system, bubble highlight annotate technique for CPT, and how it's one of the number one things our students say really helped them to pass the exam, was having that shave so much time off of answering the questions, because it helps with process of elimination and all that good stuff. She goes, I have an annotation that I do for ICD. I said, really? The whole manual? No, just the guidelines, because that's what you're being tested on, is your understanding of those guidelines. Yeah. So she underlined things, circled certain things, wrote things in the margin, and it's very thorough. so what we encourage our students to do, most of your publishers, if you're taking a paper exam, paper manual into your exam, whether you do it at home or at a testing center, normally they have the guidelines printed, not all of them. So, you might want to, when you're going to buy a new 2027 manual, make sure it's got the guidelines in it. And then you can copy the notes into your version. They don't let you print them out and take them in with you. Unfortunately, you'd have to hand write them in. But even if you don't do that and you just read them, the way that they're annotated as you're studying those sections in ICD, it will really help you sound down that information. And those are in our bonus area for our premium members. That's either a student of pretty much any course or a club member. So if you're here for the goodies that we're doing tonight, you get replay access to the videos, but you get all the handouts, all those reference tools that Alicia was mentioning. And you get the annotated ICD-10 guidelines. You get the Batcave on how to do your CPT manual. Lots of good bonuses there. So last week I did a presentation on modifiers. We're going to have that modifier tool that I showed. It's an app, interactive app, very, very helpful. All of this is going to be in the CCO portal, where everything starts there. And then depending on what you want to do with CCO, do you want to go to the Academy and do some lessons on your course, and you're going to click on Academy? Are you coming in to take a practice exam? Well, then you're going to click on the exam portal and go find your exam and start taking it there. So a lot of things are coming together, new apps. That's where you're going to go. So I wanted to let you know that.
And right before you bring that up, and we can show them too on Find-A-Code, I brought it up. A lot of us we don't use paper manuals very much anymore unless you're taking a test. But you're online in Find-A-Code, you can put your annotations and stuff like that on individual codes, because you can make notes on individual codes. And I'll show you how to do that in a minute after Laureen shows you this. And I used this AI this past week a bunch, and it worked so smoothly. So I am really thrilled with Aimee. I hadn't used it as much before because I was working on other projects that I needed. And then I jumped in on one project and started using it. And I tell you what, it saved me so much time.
Yes. And it's like how a lot of people use AI, like ChatGPT. They're using it as a kind of Google Plus type of search engine. That's what this is for. I mean, Find-A-Code's always had this search, up here where you could type in, mammography or type in the code, and, you can get to what you need. But what Aimee can do is it has access. It's trained on all of the data that you're already paying for as a Find-A-Code customer, but it gets it to you and kind of presents it to you in a very useful way. I'm going to show you some searches that I did with some CCO students. And let me see, this was one. This is someone who was using, what's it called? Practicode from AAPC. And they were very frustrated because the rationales, according to them, I haven't looked at Practicode in a long, long time, but that they weren't very good. They weren't very helpful. Getting support is kind of hard. So I said, well, after you try and answer it on your own, why don't you, because he also was a customer of Find-A-Code. I said, why don't you use their new AI and see if it would help you? So this is some of the things he and I did together. So we asked, how would I code an ORIF of the fifth metatarsal of the right foot with use of a C-arm? So very specific. And again, with all AI, we always vet, view it as a suggestion. And then, what's nice is because it's coming right from Find-A-Code, you can go right to the codes while you're in it to verify the answer that it's giving you. So quick answer, gave you the CPT code with the modifier, and it, typed it out for you, the ICD-10 code, and gave you a little bit of explanation about maybe some other specificity that you could have that would change the coding. It talked about the fluoroscopy and is telling us don't code it separately. And that was one of the things that I think the Practicode case was trying to test him on. And it helped him understand why he got his wrong. He's like, oh, and that's the whole point of doing it, is to practice and learn as you do each one. And then it gave some key notes, and it gave the NCCI check. And again, all of this is in the tool already, and you could go look up all those things but now it's all synthesized and put on one nice page for you, right? So if you wanted to jump and go check out the code, this is the main way Find-A-Code was designed. One page per code, so you can know all about that one code. So this is for 28485. On the right-hand side, you can, have this code book view, which Alicia and I love because that's how we've taught CPT, is bubble the groups and highlight them and, do that sort of thing. And this little book stack, Find-A-Code did for CCO to go along with our BAT method. So when you click on it, it highlights things that, we've gone in over the years and, said were key things. So you can play with that a little bit if you want, but it gives it in context. Like, oh, okay, this is in the closed treatment of metatarsal fraction. If you just scroll up a little, it'll expand the little book thing and you can see this is a parent code because it's not indented. These two are indented, so they have to go with the code above it. So that's a nice feature. Then they've got that CLD that Alicia was mentioning, the common language description. And then all of these are like little trays that pop out. You click the plus sign, and now you can see if you're using an encoder and you don't have the paper manual, it'll at least give you the structure of where it falls in the context of the whole manual, which is very helpful. Because when you go to just one code and you don't have the context around it, you can kind of get lost or pick a wrong code because it seems right. But when you look at the neighbor ones, you're like, oh, no, that one's actually more accurate. Let's see. Oops, let me close that down. And you just click the minus sign to shrink it up. And if there's one that you always use, you can check the auto open. And that tray will always open for you. Like if you're always checking CCI, just click that and it'll always open every time you go to a new code.
Natalie's asking if can you find DRG codes in Aimee? Does it do DRG codes?
I believe so. I'm more in the outpatient world, but we could try it. Let's see. So the way you get to it once you're kind of into the thing is you go to Tools, Search, and then Aimee. And these are all the other ways. I mean, look at all the different ways you can get to information,
That was Natalie. Nadine says, try using the DRG calculator and Find-A-Code. I've used that, and I know that works. So if it has that, then Aimee must be able to reference that, I would say. So yeah. Thanks, Nadine.
But what would be a question? Like, what is the DRG for X?
Yeah.
What would be a good diagnosis? What is it?
DRG for, cardiomyopathy, I42.9.
Let's see if it can do it without the code. Oh, what the DRG? What is the DRG? Yeah. That's almost like, what the heck?
This person said, Carolyn says, besides CCO, I've also used Find-A-Code since 2017. These are the best support for new and experienced coders. I agree with that 100%. New coders find it very user-friendly and easy. It's like they do education too. That's their wheelhouse, and that's definitely our wheelhouse. So I think it's a good grouping there. But what did it say for us?
It basically said there isn't a fixed DRG for cardiomyopathy, and MSDRG is assigned to the whole inpatient stay based on the principal diagnosis, any procedures performed, and whether a MCC is present, not from the diagnosis code alone. So I got a little hand slap. Okay.
Okay.
When cardiomyopathy, I42.9, unspecified is the principal diagnosis with no OR procedure, it groups to MDC-05, diseases and disorders of the circulatory. And then it gives these different ones, gives you some keynotes. And this is like, right now they're not charging for AI, for Aimee, because you use kind of credits and they have to pay for the credits every time they do it. So I think for right now, you can ask unlimited questions, but they have this deep dive feature if you want to have it go even further. And so maybe when it gets to the point where you do have so many credits each month for your subscription, you must say, no, that's enough, but maybe you're willing to go even deeper and deeper and have it really pull that up. So
can you,
yeah, it didn't really do too much more.
Are you able to jump off of the, into Find-A-Code and say, look at I42.9 and we can show them real quick how they can make notes on individual codes? because I think that'll be really beneficial for them to see. And this is where you would do the guidelines too.
Okay. Oh, it didn't switch. Hang on. So I basically typed the code in this search box up here, and it brought me right to this page. All right, what did you want me to do?
And so there's a couple things you can do, guys. If there is a code that you want to remember that'll be one of your codes, often used codes, notice the green plus sign. You can click that, and then the system will remember, hey, this is a common code you use, right? And so when you specialize, or say these codes are going to be changing and updating, that's a good thing to do. Now scroll down, and you're going to see the options that you have, and see where it says notes or my notes. This is where you can make yourself a note and state cardiomyopathy, is being updated in FY27, and then that note stays with that code. This would be brilliant to take the parent codes that are changing, go in, make yourself a note, and then you'll be reminded. But I really like that plus symbol, because I've used that especially in risk adjustment, or when I was doing a particular project on end stage congestive heart failure, and there were specifics on different codes that I was tracking. Signs and symptoms that I wanted linked to that code, or even preferences by the way, you can put in your notes how a specific clinician documents and what code is associated to that, so that you don't have to keep looking it up or thinking about it. It can be right there. So it's really a simple overlooked tool, I think, that is extremely handy and helpful to have.
And if you're in a facility and you guys buy like a package, you can have it set up where you have shared notes. So you can have your personal notes, and then you can have shared notes where you make it for everybody. So if there's a manager and they want to push notes down, or if you're just on a team that shares, and then you can see what other people, either maybe someone did some research and they're putting the results of that research there. So if you're going to use the code, you're reminded of that. But there's just so much to find a code. But at least you saw some of the new fun features with the AI. I recently learned this from someone who's been in Find-A-Code for a long time, List a Code. And we were looking for certain codes that contained MAMO, because we were working on MAMO codes. And let's see, I think I just hit enter. Is that how she did it? Hang on. Great. There we go. And so
where did you come up with List a Code? Where's that?
Right. Go to tools.
Oh, tools.
Search.
I wasn't into. Okay, got it.
Tools, search, and then you'll see
found it. List a Code.
List a Code. And that never occurred to me that that's how you could use this. I thought it was something else. And so explore, click on things. And and then that gave us a list, and we were looking for particular ones in the radiology section, like, okay, these are all the ones with that word. And then off we go. And you can do things like
it also has the HCC values and stuff all in there. Wow, you can put indicator flags. I didn't know that existed either. Oh, yeah. My word.
Yeah. So these are things you just got to get in and start, using it, and you'll end up really loving it. So at any rate, I don't see any other questions. Let me just switch real quick to some announcements. I think this is the one. Yes. Okay.
That's the one thing about tools. They're only as smart as the people using them.
Yeah. So I want to wish everybody a wonderful, happy 4th of July, Independence Day, our 250th year. It's amazing. That, to me, what's amazing is that we're really young, in the United States. So I'm very proud to be an American. And last July 4th is when we launched our new academy. So it's kind of very exciting for us. So we're having a 25% off Independence Day sale on all of our courses and blitzes, and even the annual club membership is deeply discounted. Instead of $249, it's $199. So if you go to cco.us, you'll see the banner at the top. It'll take you to the page. It's very simple to pick what courses you want. Really good if you've been eyeing a lifetime course versus a subscription, because you can get it, for instead of like $1,400, it's like just a hair over $1,000. So it's a really good deal. And you get all of the bonuses. You get the blitz, you get the practice exams, you get the phone support with us. So check that out. I wanted to make sure that you saw that. We're also getting into creating new courses. The CDI one is all finished. Had a lot of interest in that. People are enjoying this course, and it's unique in that it prepares you for inpatient and outpatient CDI in one course. So then you can choose what certification you want to do, but you'll be a well-rounded CDI specialist. You'll understand both worlds. This is our first specialty course. This is for home health. And this came from a club member that said, I have been offered a job in home health and I don't know what the heck I'm doing. Do you have any resources? And we didn't really have anything in the club yet, maybe a few little questions. So we decided to create one, and it's done. It's recorded. It's up. It's ready to go. We're going to be doing, depending on the length of specialty courses, the prices might vary, but we're introducing this at $299, but it's on special with the sale at 25% off. So check that out. Just go to cco.us home-health-coding-course. But basically, if you just go to cco.us, you'll see where the courses are, and can get to the links. But check that out.
I got to do 5 years in home health, and it's very unique, but it's satisfying too. Really a great area of medicine to be in, and its own little world. So I encourage you guys, even if you think you might be interested, there is a lot of need for that specialty.
And it reminds me a lot of risk adjustment, because it's very much driven by the diagnoses, and they need to match. And there's this OASIS thing you have to do. It was very, very interesting. So Michael is asking, when do the next CDI and forensic classes start? So the CDI course is at your own pace. It's up. You can enroll and start at any time. The forensic course is under development. We've done a lot of our background research. We've got our outline. We're starting to create the textbook. So that's going to be, at least a few months out, but the CDI is available now. And if you guys have certain specialties you really would love to see, let us know. We want to obviously do the more popular ones first, and, eventually work our way to, all the specialties, so that, you're well supported. So, and a lot of our practice exams that we create are now in our new portal, which is a very nice interface to do your practice exams. We're trying to emulate what it's like on going to like those Pearson testing centers, or where you're just using a screen. You can't use a piece of paper like the old days. You can have your paper manuals currently, but you can't write any notes in your book. You can't have a pen. They have cameras on you, so how do you do it? So we created our CCO portal, which I can show you. And it's just portal.cco.us. And this is the starting point. Anything like, once you're a member of CCO, whether it's a free member, a student, a club member, this is where you go now. And if you're a free member and you're looking for CEUs, this is where you're going to come once you get all signed up, and you're going to come here and you go to exam portal. And this is tailored to you. So for me right now, I'm enrolled in the PBC course. Here's our club CEU. So you can just expand that and see all the ones that are available to our club members. And then we have our free CEU. So here's the one for tonight, 2027. You just click start, and it tells you a little bit about it. You click begin exam, and there's 10 questions, and you can, skip around just by using these little square tiles. But here's the first question. You can rate it easy, medium, hard. That gives us feedback. If you feel that there's an error, I would put the feedback like Brugada sounds like something you'd order at an Italian restaurant.
It sounds like a car. Bugatti is a car that nobody can afford.
That doesn't sound like a syndrome. That sounds like
No.
either food or a car or something like that. But at any rate, and then if you want to skip the question and come back, you can flag it and then go to question 2, or click next and go to question 2, and you pick your answer. So it's very user-friendly. It has the scratch pad up here, which they do allow you at the testing center. And if you're doing home testing, so you can't, have a scrap piece of paper, but you could use this as a scrap. So people are doing stuff like A, B, C, oops. And then as they're going through the choices, like picture a typical CPC exam with 4 or 5 codes and answer A, 4 or 5 codes and answer B, and now you're doing your process elimination and you say, oh, it's not B. So I'm going to put an X through it, or I might just delete it, and then I keep going and I said, oh, it's not C. So now it's between A and D. And then you figure out, oh, it's not A. So you're left with D, and then boom. Right. So that's different ways you can use it, and it emulates the real exam, so you can practice the technique as well as test your knowledge. So
that's the key.
So, all right. Oh, someone said it's a car. Brugada is a car.
Bugatti, but that was Brugada syndrome. Yeah. But still, my kids my boys would walk around and you'd say, what kind of car do you want? I want a Bugatti. Okay, Deborah just signed up for Find-A-Code. Yay, Deborah. Congratulations. Let us know how much you fall in love with it.
And then once you start taking CEU quizzes with us, or course tests, practice exams, it'll show up in your grade book here, and you can come back and visit your scores. So I've been playing around as we're setting this up, but here was I didn't do well on my PBC chapter 1. I only got a 68%, but I can come in here and look at it. And, I got question 7 wrong. What did I do? And these are where we have our rationales, really good rationales. We give you the source. So if you want to go do some additional, education, you can do that. So it gives you your overall averages.
Another thing that I might do a little shout out real quick is that one of the services that we offer our students is once a month we get together, and Laureen and I will just open forum, whether there's 1 student or 5 students or 10, that we just talk about questions, follow them, encourage them and stuff. So it's a personal touch a lot of times you don't get. And I think not only do we have a great platform, but we've got great support as well.
Yeah, this is a Zoom call. And last week we had a really good group. Our last time we did it, we had how many did we have? 10, 12?
I can't remember, but it was good. And we talked for quite a while.
And it's open. We don't have no topic prepared. And we normally see where people are at. Are you taking a course? What are you doing? And then we just start talking along those lines, or someone, might be interested in risk adjustment, but they're not sure. And then Alicia will tell them all about it. We'll find out what their background is. And then we'll say, what would really be good for you is probably something like this. So we give career advice, just all sorts of things like that. So
real casual,
But we're going to let everyone go because, we've been here a little over an hour. So we appreciate your kind attention and supporting CCO and Find-A-Code and learning about that. So feedback, give us feedback. Go to the CCO.Academy where we have all our discussion area. Let us know what you liked, what you didn't like, what you'd like to see more of. We have a topic request form if you want to put topics in. And we're working with the Find-A-Code folks too to see what the top Aimee requests are. And we're going to start developing topics based on what we're going to see as the top items. So
if you sign up with Find-A-Code too, let them know that you heard about them from us, or that, we were helpful in answering questions about Find-A-Code. They would probably appreciate that as well.
Yeah.
Track it.
All right. Thanks everyone. Have a good evening.
Bye.
Looking for medical coding, medical billing, and risk adjustment education? Learn more at cco.us.